Welcome to the Java Cafe, Java fam. Good morning. Welcome to the Java Cafe, Java fam.
Good afternoon, actually, everyone. Good afternoon. We are here this afternoon for a midday Java. I mentioned this morning and then had a little tech difficulty. And to be very honest and transparent, I was getting ready to eat lunch and I'm like, oh my goodness. And so I want to thank my guests for their patience. But as we've done the past couple of years, we've partnered with MassHealth Connector to ensure that you are aware of the information, but most of all, the information about health insurance that's available to you. As you all know, and we'll kind of peek at it right now, we did a little thing with MassHealth Connector a couple of months ago. And so we're going to look at that real quick and then bring in our guests to talk about the availability of insurance, especially for this group we're going to hear about right now. We'll be back with you in 2 seconds.
For the innovators, the dreamers, the risk takers, independent workers who keep our neighborhoods thriving, Connector Care from the Massachusetts Health Connector has plans for every lifestyle and budget.
Having access to affordable healthcare is for everyone in our community.
Connector Care plans help more people save on healthcare that covers all their needs. Find out if you qualify for Connector Care. Visit mahealthconnector.org or call 1-877-MA-ENROLL.
So that's not a strange video to those that are in the Java Cafe. But listen, do me a favor, hit that share button and invite others to come in and chat with us as we talk with Audrey about MassHealth Connector. Jason, aka Jeff, you remember, and he was here before, has been with us before. And so we're going to hear from Audrey today. And I'm also looking forward to hearing from her about the importance of women, single moms for their children, getting healthcare and access to healthcare insurance to ensure that you are healthy. And so without further ado, I would like to introduce to some, and Audrey, I believe it's important to pronounce last names correctly. So I took a stab this morning. Gasteier?
Gasteier. So Audrey Morse Gasteier. Thank you. Good, very good effort. Everybody kind of wants to make it sound French.
I was getting ready to say, just to sound a little, extra and, wonderful. But Audrey, first of all, my apologies with a little bit of the tech end time, to be very honest, but timing is everything. And someone here at 12:23 and on is going to hear about health insurance. And so this is a partnership that we have had for the past couple of years. Jason has come on a few times, but you're here with us today, and tell us about your role there. Well, start off with a little bit about you and maybe your story and how you landed in a position to ensure that people are covered for their health care. I would really love to hear that.
Sure. And thank you so much for having me on today, Jimmy, and for the work you've done to help us promote health coverage through the Health Connector. You were superb in that ad. So it's a real privilege to be on with you today and with your listeners. So yes, I'm Audrey Morse Gasteier. I'm the Executive Director of the Massachusetts Health Connector. I've been in that role for about a year. I was appointed by Governor Healy and Secretary of Health and Human Services, Kate Walsh, last March. But I've been working at the Health Connector for about 12 years, and I've been working in state government on health policy topics and health coverage for about 18. It's kind of surprising when I hear myself say it out loud. It's been a while, but basically my entire career has been about trying to expand health coverage to as many people as possible here in the Commonwealth. I was really fortunate to get to work in state government on health policy right after Massachusetts passed its own health reform law back in 2006. And as you know, that helped influence the Affordable Care Act, Obamacare. So I've had this real privilege to be on this ride where we've been doing incredibly significant work here in Massachusetts, but also helped influence the national picture and bring a lot of the benefits that we knew were so important here in Massachusetts to the other 49 states in the country. So I love my job. I love getting to have the role that I do, and I have an incredible team, and we're pushing ourselves harder and harder every year to try to reach more people and to really push the envelope and be on the edge of making sure people have healthcare justice, that they have their healthcare needs met. And again, we're pushing the envelope on ways to do that in ways that are kind of forward thinking and making sure we're meeting the needs of the communities we're here to serve.
I really appreciate that. And I mean, this partnership is a real demonstration of that. Since I believe about 2021, we have ensured that we've shared this information with this audience and more as well. I want to ask you a little bit, if you don't mind, to talk just a little bit about the importance. When you talk about the community, we've had, 2 testosterone holders on here talking about this the last couple of years. How important is it, Audrey, that women ensure that they're in, no pun intended, well, 2 different, ensure that they're insured not only for themselves, but if they have children, even if they are married, and there may be supplements if their partner or spouse doesn't have a certain amount of income. And so can you, as a woman, please speak to that? I would really love to hear your perspective.
Absolutely. It's such a good question. I don't get asked that a lot. I appreciate that. So health coverage is vital for both healthcare access, right? Making sure we're getting the care we need, our families are getting the care they need. If you get sick, if something happens to you, an accident, a lot of people think I'm healthy, I don't need anything, but you just never know when something could happen. We'll all be patients at some point, right? We'll all get sick at some point, something will happen. So making sure you can get your needs met and your family's needs met when something does happen, critically important. The other piece of it is preventive care, right? And that includes everything from screenings to make sure something gets caught before it becomes a real sickness and makes you more ill. There's so many components of health coverage that are really important for people's health. And women do tend to be the decision makers in their family about healthcare. There's lots of data that shows that. That's true in Massachusetts. That's true across the country. Women tend to be the people in the household who are kind of thinking ahead to, this is something we need. We need this to stay healthy. So we count on women in that way. It's so important for their own health, right? And there's all kinds of reproductive health aspects, contraceptives and the rest that women need to think
justice
to them. Absolutely. Reproductive justice. We're very fortunate. We have all kinds of protections here in Massachusetts. The Affordable Care Act has done a lot of work on that, but obviously we know nationally reproductive rights are under siege. We're very fortunate to live in a state where there's incredible amounts of resources devoted to making sure that that is not compromised here in Massachusetts, but that's all part of healthcare. The other piece I would just mention, and I know this is always top of mind for women who also often manage their household budgets, is health coverage is not just about getting to the doctor and staying healthy. It's that's critical, but it's also an economic protection tool, right? So if something does happen and you have to go to the hospital and you don't have health coverage, those bills can come in fast and furious, and they can be big, and they can be financially devastating to people. So I think it's really important when we talk about health coverage, talk about healthcare and health outcomes and all of that. It's key, but it's really a financial protection tool too. And for most people, who has that give in their household budget to be able to manage an unexpected huge hospital bill? Medical debt is a serious issue. It's a growing issue. And the last thing we want is for moms and kids and dads and families in the community here in Massachusetts to be hit with unexpected financial hardship like that when it's already so hard just to make ends meet, with your grocery bill and your gas bill and the rest. So that would be another plea to folks listening. Certainly, again, moms and women who are kind of minding the store on their household healthcare choices and financial choices. Health coverage is a really key part of your financial health as well as your physical and mental health.
So I'm a political wonk, and I love policy, and you can hear that you've spent some time in policy around health equity. One of the things that I heard from you is when you talk about the financial piece, there is also an added benefit that healthcare, MassHealth Connector can cover, is also the mental health aspect.
Yeah.
Because with that economic, you're getting bills in and trying to manage, there is a whole mental health aspect that comes with. And so I really appreciate you going there and sharing that information. I wanted to be very intentional and speak to, it's a large population of the Java Cafe women ages, I believe 35 to 54. And so I wanted to be sure that we cover that. And Jason definitely could speak to it, and we've talked about it, but there's nothing like hearing directly from someone who is a part of a demographic to which we're trying, to reach. One of the other demographics is someone like myself who is like a 1099er. That's what that commercial, was about. Thank you for being so gracious. It was shout out to your team that really, I just moved here the day before. And they came in and did everything they needed to do. So shout out to your team that make that happen. But you talk about intentionality. What was the intentionality of ensuring that this insurance was available? One of the script pieces was available to all communities.
Yeah.
And that is a population that became very hit the forefront when it came to lack of healthcare coverage, because if you're a 1099er, income can be zero for 2 months, and then it could be, 20,000, each month for the next 2 months. And so what was the intentionality around ensuring that that part of the community knows that there's insurance available to them?
Absolutely. So I would say in general, kind of unwinding a little bit, the creation of the Health Connector, which is, a health insurance marketplace or exchange. Sometimes you'll hear those words interchangeably. Really, that was a lot of who we were thinking about when Massachusetts created health reform and the ACA, Obamacare came along, was thinking about who are the people who don't get coverage through a job, right? They don't work a typical, 9 to 5, where that's part of the benefits package. And it was really about creating an on-ramp to coverage for people who weren't already covered or eligible for a program, Medicaid or Medicare or through a job. So that's always kind of been a part of who we serve and think about. Are those people, I don't want to say they fall through the cracks. They don't fall through the cracks in the world or their community, but in the health coverage landscape, they did. So that was a big part of why the connector was created. So it's always kind of been on our mind, but we started
Hold on. You're revealing something here, because presumption was that, as I just said, this group came to the forefront post or during pandemic. And you said that this is something that's always been. Can we agree that because so many people went into the 1099 space, was that okay?
That's exactly where I was going to go next. So that population has grown incredibly since the pandemic, for all the reasons right? A lot of people decided, they're kind of taking stock of their life. I want to do something different. We all started making different economic choices at that time. So the gig economy or 1099 economy, whatever people want to call it, has certainly grown incredibly. So that's one piece. And I think that's made us want to double down on how are we thinking about how we reach these populations? How are we thinking about how we frame our messages so they think, oh, that's me. They're talking to me. And I know somebody who once talked about the connector is sort of like the HR department for the state. If you're, you don't have your job and you've got an HR, you can walk down the hall. They help you get set up with your health insurance. For everybody else, that's us. We're your HR department. So there's that piece. The other thing I would note is that our Connector Care program, so anybody can come into the Connector. It doesn't matter your income. We serve low-income people, high-income people, everybody in between. Everybody can come to the Connector. It takes all comers. But we have a special program called Connector Care. And historically, it served low to moderate income individuals below 300% of the federal poverty level. And this past summer, Governor Healy signed the state budget, which created an expansion of the number of people that could qualify for Connector Care. So now we're up to, sorry, this is kind of wonky, but 500% of the federal poverty level. We'll wonk out.
The policy side coming out. I'm with you.
It's there. It's here. So it's going up to 500% of the federal poverty level. Let's talk in plain English. That means someone earning about $73,000 a year if they're a household of one living on their own. A family of four, that's a family of four with a household income of about $150,000 a year. So we're like straight into moderate middle incomes there. So that expansion of Connector Care means even more people are qualifying for very generous financial assistance that makes their healthcare costs even lower. So you take the combination of, we've got even more people in the gig economy who are probably making, decent money, but don't have coverage through a job. And so and we have Connector Care getting expanded. So even more people are qualifying for extra financial help from the state. So that to us really underscored, let's get out there and really drive this message to gig workers, 1099 folks, because there's so much on the table for them. We want to make sure they have coverage anyway, but this year in particular, wow, there's all these additional savings that just weren't there for the last 17, 18 years of the Connector's existence.
not to overstress a point, but if you talk about the entrepreneurs in that gig economy growing, some of the latest data shows that when we talked about women, now let's talk about Black and brown women.
Yep.
They are also part of the biggest population of entrepreneurs. So I
Mhm.
would presume that also okay, let me see how
Yeah.
deep you go into policy. Do you have
Yeah.
any data? Do you
I
have
don't
any?
have data off the top of my head, but I will say linking two things together, and I'm so glad you went there. So we think a lot, in Massachusetts about how do we expand coverage to even more populations. When you look at the super high level data, Massachusetts is about 97% covered. And a lot of times in policy circles, I'll be candid, people, there's a lot of applause for Massachusetts for that because we are the furthest ahead of any state, of any 50 states. But when you start to untangle, and I'm sure you know this, I know you know this, when you start to untangle that data, it doesn't look as pretty for every population. So we can see there's incredible disparities in coverage by race and ethnicity. So our overall coverage rate in Massachusetts is the uninsured rate is more than double for Black population, Hispanic population. So when you start to kind of untangle what's going on at the aggregate, we can see those disparities are real. And so all the stuff we talked about, why coverage is important, it gets people to the doctor to stay well, to get better when they're sick, and for financial protection. The idea that there are communities that are Black and brown communities that are enjoying less of those benefits when they're paying taxes, they need those healthcare services just like anyone else. They need those financial protections just like anyone else, is wrong. It's unjust. And that's a big part of what we're trying to focus on and think about in terms of the outreach we're doing. So thinking about Black and brown women, thinking about, all different kinds of communities. How can we tailor our messages in a way that's going to be most likely to resonate? And making sure that the coverage and services we're providing are really responsive to people's real lives and what they need. So it's both about getting to people, talking to them, yes, but then also, are we making sure the coverage we're providing is accessible to people, that people can really get appointments, that their care that they need, the medications they need are there, are affordable, because, it's a bigger issue in the country that even for people who are insured, sometimes it still costs a lot of money to go and see a doctor, to get your prescriptions filled. So that's another part of how we think about equity in the context of health coverage is not just bringing people into the ranks of coverage, hugely important, and there's still work to do. But what about that coverage itself? Once we link people to the healthcare system, are we doing it in a way? Are we making sure that healthcare system is showing up for people?
Audrey, I have a full intersectionality question based on your last answer and also the point about Black and brown women in the economy. And there's a little bit of behavioral health in here. And so No Stones Thrown Counseling is owned by a Black woman who I've seen her journey to achieve to be a independent third party clinician. She was asking, I have a question about credentialing for startup third party billers. How can MassHealth, now this is MassHealth Connector, but Audrey, given just the past few minutes, can maybe speak to this a little bit or direct Dina to this information, because your answer here is informing a provider, a Black woman, an entrepreneur, but then also has 2 children that needs to, and you know what I mean? So
yeah, it all comes right. It's so true. We interact with people all the time. It's like they're a provider, but they need coverage. We're not all wearing one hat at one time. So
absolutely, and especially for women.
For
What I
sure.
mean? So right here, demonstration. How can MassHealth how can MassHealth support processing credentialing applications for entrepreneurs that are third-party providers, specifically in this case, in the mental wellness space?
That's such a good question. So I'm going to need to pitch that to MassHealth. So
Okay.
MassHealth is a distinct agency from the Health Connector, but I can get that question to the right person there. So Jimmy, if you can help me connect me to that person, and we'll make sure you get that question. And it's such a good question, right? Like, how do we reduce kind of the administrative burdens and the hassle factor for people who are trying to provide services and they want to devote more of their hours to actually interacting with patients rather than dealing with all of the paperwork and those kinds of hurdles. So let's get that question to the right person, and I'll make sure we get that to resolution.
Absolutely. I tried to throw it in real quick and was kind of corny, but I said connect. No pun intended, but that's happening. And so, this is kind of what happens in the Java Cafe. One of the things that you also mentioned was that you're going to be willing to help navigate that for that entrepreneur. Can you talk a little bit that Jason, first of all, Jason, the next time we partner, y'all are going to be in competition because I love the energy. No, cool. But can you talk a little bit about the navigators that are available in the community as well? What was the intentionality there to ensure that people are can talk to someone that looks like them, that speaks the same language as them. You talked about that disparity. What is the intentionality of the navigators?
Yes. So I love the Navigator program. So I'm so glad that you went there. So I have to give credit to the Affordable Care Act and Obamacare for this idea. So, Massachusetts, we'd been around doing our thing as an exchange for many years before that came along. And we always partnered with community groups to help raise awareness about coverage. We always had folks who could help people with their applications in different languages. But it was the Affordable Care Act that introduced the Navigator program. And the idea, and it was a brilliant one, was let's make sure we have trained staff in the community at organizations that are designated as the go-to spot for your community. They speak your language, and you can sit down with somebody who can help you fill out an application or help you stay in coverage. So we don't talk about this enough, but there's work involved in staying in coverage. Sometimes you have to provide documentation that shows your income so you can, continue to access subsidies, whatever it might be. So the idea here was that there would be these folks that would be, trained and certified by the state, by the exchange, by the marketplace. And so we wholeheartedly adopted that model. I think we have 22 navigators now. We've been
I'm trying to
adding
actually find it. I'm looking at it now so I can show it on screen, but you go ahead and keep talking.
Okay. All right. Perfect. We'll collaborate. So the idea is we've got all these organizations across the state that are called navigator organizations, and you can show up to any of them. You can make an appointment with folks. They can help you in person. They can sit down with you, go over an application in your language. Folks from your community who look like you, understand you, your neighborhoods. And they will assist you in any way you need in terms of getting into coverage. And the Health Connector and MassHealth, our state's Medicaid program, we share a joint application for people who are seeking financial assistance. So they can help you whether you're MassHealth eligible or whether you're Health Connector eligible. It's sort of one common front door you can work with a navigator on. So the idea is just, we know, I mean, it stands to reason, it's common sense, but data shows it over and over. For a lot of people, the process of getting into health insurance, it's kind of overwhelming. It's a complicated application process. There's a lot of legalese sometimes in the application itself. So being able to sit with someone who understands you, your community, your busy life, and walk you through it and just make it a little bit less intimidating and make sure you get across the line. So important. We see that our people who use navigators and use them on a regular basis are some of our most happy people. It just helps people out. And so for folks listening who are interested in connecting to a navigator, oh, perfect, you've got it. So if you go to our website, which is mahealthconnector.org, you can go up. There's a little tab up in the top kind of line there that says Help Center. Drop down to find local help. You can put in, your town or your zip code, and it'll pull up the navigators that are close to you. So in the Boston area, for example, we've got Boston Public Health Commission, MAPS, Cambridge Economic Opportunity Committee, Upham's Corner out in Dorchester. And these folks speak dozens of languages. Again, they can help you in person, over the phone. And they're just like, these people are angels. They do such hard work, and they're so committed to the work they do to get people into coverage. And they just know a ton. So I'm indebted to them because they're really our front door to so many communities in terms of being kind of a safe landing place for people. They also are so knowledgeable, and they share back with us what they're hearing from people on the ground, where people are running into issues, what people's challenges are with accessing healthcare and coverage. So they're treasures in the health coverage landscape and the work that we're doing.
I just wanted to make sure that folks also saw it's easy to go in, and some folks might yell, Jimmy, we can't see the text, but as much as possible, showing you that you can go in and simply put your zip code and find different places to go find a health navigator if you have questions. One of the things that I also noticed was there's the individuals and families, but then there's also the ability to, and let me navigate back to it. Employers and obviously employers, but employees can also go navigate if maybe. Now that option, is that in case maybe they opt out of their, employer health insurance, they can go after their own. That's just the on-the-spot question. Sorry.
Yeah, not at all. So we intersect with businesses and employers in a couple different ways. So for small employers with fewer than 50 workers, they can actually get group health coverage through the Health Connector. So, if I run a restaurant, I've got 15 employees, and I want to offer coverage to them as part of their job benefits, I can do that through the Health Connector, and happy to talk more about that. There's all kinds of good reasons to do it. You you can create choices for your employees where they can pick whichever health insurance company or plan they want. That's not true for most small business coverage. So we call that Health Connector for Business. So you can get to that through our website. That's its own thing. But there are individuals who, are certainly employed. We cover all kinds of people who are employed and are either not offered coverage through their job, or maybe they're offered coverage through their job, but it's not affordable to them. And so that's another kind of intersection we have to make sure that people who are employed or employees understand that anybody can buy what we call an unsubsidized plan through the Health Connector, even if their employer offers them something. But you can also qualify for subsidized coverage if the coverage your job offers you is not considered affordable. And there's kind of wonky definitions for how that gets determined. But in that way, we see ourselves as kind of partners with the business community. We want to see employers offering good coverage, but we're also there to capture people who, for whatever reason, aren't eligible for that. They're part-timers, they're contractors, whatever the reason might be. And we're that other HR department for people, and that, we're there for people whenever they might need us.
I actually like how you said that, the HR department, because for some in this virtual space, it is important to be able to kind of, go down the street via the internet and just get your questions answered. I've never heard it put like that before. So it just really speaks to the Health Connector's, again, intentionality of ensuring that everybody has the information. Audrey, was there anything that we missed? We talked about the navigating. We talked about 1099ers. We talked about women. We talked about entrepreneurs. We talked about Black and brown women. We talked about equity.
I think we covered some really good stuff. I think the other thing I would just point out is we're in an open enrollment period right now until the 23rd.
Yes.
So this is the time of year when anybody can come into coverage. They don't need a quote unquote qualifying event or anything like that. So if anybody out there is listening and doesn't have health coverage, this is the time to come in. And as I mentioned earlier, there's never been more help available from a financial assistance perspective than there is right now. So this is a really good time for people to get covered. We know a lot of people over the last year have been losing their coverage through MassHealth because there's been this big redetermination process. So that we know there's a lot of people out there who may be uninsured or maybe kind of between coverage. They're in a coverage gap. So we really want people to take that action before the 23rd and get into coverage. But I will say, if you lose coverage after the 23rd, whether it's MassHealth coverage you might lose or through a job, there are always opportunities to get into coverage at other times of the year. But this is when we're kind of loudest, and we really want to kind of get the energy up and make sure people know about that deadline on the 23rd. And if you sign up by then, you'll have coverage effective February 1st.
It's so funny because I forgot to say it here. And when I talked about coming back on this afternoon, I did say it then. And so we want to reiterate that open enrollment ends on January 23rd. Sign up now. The other piece is that there are life-changing circumstances that I mentioned this morning, that if you have a child, if your relationship status changes from a legal status, like if y'all just chilling, then whatever. But, if you were married or considered or whatever, that changes. You need to get some different coverage. Now, can I ask, and I'm thinking about this in real time, is loss of coverage okay?
Yep, it is. I'm glad you asked. It absolutely is. So there's all kinds of ways to get in outside of open enrollment. So loss of coverage, you get married, you have a baby, you newly moved to Massachusetts. There's all kinds of things like that. I will also say, we talked about our Connector Care program for low and moderate income people and all that extra support that is provided there. If you apply, let's say you apply in March and you are found eligible for Connector Care, that's considered a qualifying event. So that's important information for people to have. Again, we don't want people to sleep. Get in now if you think you need to. But we create a lot of on-ramps for people throughout the year. So if you are found newly eligible for Connector Care, you can get in that month.
I definitely want to make sure that folks understood that. We have the number here down at the bottom for you to call, the 800 number. Also, if you are needing to use the TTY system, that number is there as well. The other piece is we want to make sure in the comments, and it is actually hyperlinked. So right when we get off, or I give you permission to leave early dismissal, click that link there and go find out. One of the things that Jason often says is the worst thing that they can tell you is, oh, we can only give you $5 support, or, we can say no, or whatever. Apply. It does not hurt to apply if you think this is something that's going to be beneficial to you. And the other thing I meant to say is you may not get full coverage, but isn't there subsidies? But just for clarity, you can you get insurance through somewhere else and still get a subsidy, or is the subsidy applicable through the connector?
It's only applicable through the Health Connector.
Okay.
And that's super important for people to know because, and this is why it's really important, people don't Google around for health insurance. Like come to the Health
Yes.
Connector. It's
Can go there about the predatory people,
yes. So
especially our seniors.
this makes my blood boil. So there's a lot of actors out there that market health insurance products to people, particularly online. And sometimes they try to mimic what the Health Connector looks like or another Affordable Care Act marketplace. So if you Google, affordable health insurance in Massachusetts or cheap health insurance, you might find yourself on one of these web pages that's actually selling you something that does not meet state and federal standards, will not be there for you if you get sick, you'll have unpaid medical bills. There's some sketchy actors out there and they prey on people who are in a rush and looking for something affordable that they can get. So that's why it's really important people understand the Health Connector is the place to come for coverage. It's the official marketplace of the state. Everything offered is vetted. We do a ton of work to make sure this is very high value coverage that meets very, very strict state standards in terms of how protective it needs to be for you. And we're the only place where you can qualify for subsidies that lower the cost of it. There are no other entities in existence in Massachusetts that can offer you subsidies on your health insurance. So we're the place to come.
I saw the policy come out too, and I saw a little
little fire in my eye.
Yeah, because it just when Jason mentioned that before, I just I have that population, the 35 to 54, but I have a whole group of what I call the mother's board in here, and I'm always afraid, like even on Twitter, when certain bad actors look sketchy and follow me, I block them because I don't want them sending links. To seniors on social media. So thank you so much for raising that and having that passion behind it. Audrey, you and Jason will figure out next time. I'll leave that choice to you all. God forbid if we ever get together and have a sit down.
I would love it.
That would be awesome. We would turn that into a whole podcast.
I would love
because it's so important about the health equity piece to be there. And so thank you so much for coming in with us today. Again, my apologies on the time piece, but timing is everything. And I'm glad Dina, that provider, was in here. I'll get you connected with her to ensure that question can be followed up on. I may see you this evening later on. So somewhere along the way, we'll try to figure out, I'll look a little different, but we'll figure out how to see each other and shake hands. But so good to have you here today. Please give Jason my best and the folks over at ASG for making this happen. And we'll talk soon.
Thank you, Jimmy. You're the best. Thanks for having me on.
All right. Thank you.
All right. Take care. Bye.
Folks, that was Audrey from MassHealth Connector, who really, you could sense the passion from her about getting the information out to the community. So we're glad that she was here. And I can't believe I got ready to call Jason Jeff again. Y'all remember that? He called me Jalen when he was on before. Listen, quick midday Java, just to make sure the health information is out there. Please join us tomorrow morning. What time tomorrow morning, everybody is still on? What time tomorrow morning? Tomorrow morning at 10 a.m. 10 a.m. tomorrow morning at 10 a.m. We hope to see you here tomorrow morning at 10 a.m. And we'll talk to you then. Have a great day, everybody. We'll talk to you soon. Peace.